Hi, I'm Jitin Joy. I'm a psychologist. In this video, I'm going to speak about what is autism and what are the symptoms of autism. So, autism is a neurodevelopmental disorder. It is known as neurodevelopmental because it affects the neurological system, how the brain works, and also it starts at an early age, causing major developmental delays in a child. Therefore, it is known as neurodevelopmental disorder. The symptoms of autism varies from child to child. So let's see what are the major symptoms of autism. The first symptom is problem with communication and socialization. Most of the children with autism, they don't know how to initiate a communication and sustain in it, and also they don't have social reciprocity. So when it comes to communication, there are two types of communication: verbal communication and non-verbal communication. Most of the children, they don't express verbally. They don't have vocabulary. Even if they have vocabulary, they don't know in which social situation or context they have to use that particular words, and also they don't know to construct a sentence with the vocabularies they have. They cannot think in an abstract way. And coming to non-verbal communication, in order to have an effective conversation or communication, we all need non-verbal communication skills. That is giving eye contact or understanding others' emotion, attitude, feeling. So children with autism, most of the children, they don't give eye contact. Even if they give eye contact, they don't know how other feels or what is their emotion, or they cannot imagine what is their feeling, attitude, and behave accordingly. So these are the problems with communication. And when it comes to social reciprocity, children don't have proper awareness of their environment. If most of the children, they will be engaged in some particular activities, they don't observe what is happening in their surrounding. So they don't have a proper social awareness. Next, we can see persistent, repetitive, restricted, or inflexible patterns of behaviors and interest or activities in children. They have repeated behaviors. There are many things that comes under this. The child with autism have difficulty to adjust to a new environment. Suppose if they have been taken to a new park or a school or a mall where they haven't been before, they have difficulty. They will take time to adjust to that particular environment. It can be because of many other reasons, like it can be due to anxiety. Children with autism, they don't know what is going to happen next. So it can be due to anxiety, or it can be due to sensory issues. Next, let's see, they like to stick to a particular routine. Suppose a child who is waking up in the morning, then he's getting ready for his school, then he's coming back, having a sleep, then going for a walk. If there is a routine every day, he will expect that routine. If there is any disturbance or if something is not happening in that routine, he will get disturbed. It is because of their nature. They always want things to be in order or in routine. The next point under repetitive behavior, we can see that children with autism, they have a ritualistic pattern of behavior. This is also called as obsession. Like if they have been given some toys, or if they have given some blocks, or if there are some chairs in a room, they want to keep it, line it up and make train with it, or they will stack it up and they make tower with it. There are many type of obsession that children have. Some children, they keep on holding something in their hand. It can be a crayon, or it can be a ball, or it can be a block. So they have an obsession with some material. Not only in the toys, they have their obsession in their mind. They always want the things to be same, like they want the doors to be closed, or they want the switches to be off. In repeated behavior, we can see that children with autism, they have a stereotyped or repetitive motor movements. This is also known as stimming. Stimming is the repetitive movement. It can be vocalization as well as motor movement. Like most of the children with autism, they keep on rocking, or they keep on flapping their hands, or they keep on turning their heads, or they keep on shaking their hands in front of their eyes. Some walks on toes, some keep on jumping. So these are all because of the sensory issues. These are the repetitive movements. And in vocalization, they keep on stimming, verbal stimming. That is, they keep on singing some rhymes, or they keep on saying some words, particular words. They all the time they repeat, which they might have heard recently, like A for apple, APPLA, apple. They keep on saying some words which they have learned recently. These are some of the repeated behaviors that we can see. So we have seen the problem with communication and socialization, the repeated behaviors. Now we are going to see the sensory issues. When it comes to sensory issues, it can be hypo or hyper. Hypo means children with hyposensitivity, they are understimulated. Like if it is related to vision, they even if the light is brighter, they cannot experience that. Or if the sensor is hypo for hearing, even the sound is louder, they cannot experience it. If he is hyposensitive for touch, he cannot experience the texture, or even if hurt, he cannot experience that pain, feel that pain. If it is hypersensitive, he feels pain, like more pain than a normal person, or the textures and all like very irritating or discomfort for the child. Traditionally, we know 5 sensory systems, but more than this 5 sensory system, there are about 21 sensory system are in work in our body. So all the sensory systems gets affected. And also, it is not that in a particular child all this sensory system are either hyper or hypo. It can varies from child to child. Maybe in one child it can be some areas can be hyper, like vision, for vision and touch he can be hyper. At the same time he can be hypo for auditory. So it varies from child to child. These are the major symptoms of autism. So if you find these symptoms in a child, take the child to an autism center or a psychologist. So it's easy to mold a child at an early age. So I hope this video is helpful. Please, thanks for watching.